Well, naturally, we're in a lot of the individual PBM contracts. Most of the practices that dispense are in a lot of those contracts, and certainly all the Medicare patients and Medicare Part D, which is any willing provider, we are allowed to participate in all those contracts. But there are some payers where we're excluded. So we found it a great opportunity to be participating in these alternative payment models with some of these payers. And the whole idea is that if we're going to go at risk for the cost of all these drugs, there's so many oral regimens now that we should be able to go at risk for the orals as well. And it's hard for us to justify taking that risk if we can't actually dispense those drugs in our pharmacy and inside of our practice, so that we can manage the cost of those drugs and the waste. And there's a lot of different things that impact patients that are on orals, including dose changes, drug holidays, like I said, drug modifications, where, a typical pharmacy outside of the practice might continue to fill the drug. We have access to the EMR, so we're able to, anticipate when patients are likely to need, a change in the oral therapy, and not dispense a very expensive oral medication for another 30 days.